Hello everyone, I'm Dr. Shraddha Jadeja from Department of Pediatric and Preventive Dentistry, second year. Uh, Today I'm taking the remaining class of non-pharmacological behavior management. So today we'll see about the various behavior management techniques. Uh, First one is voice control. It was given by Pinkham in 1985. So it is a meticulous alteration of voice, volume, tone, pace to influence and direct the patient's behavior. So if a child is uncooperative, then dentist can raise his voice, but he doesn't have to shout, but he can raise his voice, and the firm voice can help the children or can manage the children. So the objectives is basically to gain the patient's attention, to avoid the negative behavior, and to establish the authority so that the child can understand he or she has to listen to the dentist. So it's a basically alteration of voice volume or tone. Indication mainly used for uncooperative children. Contraindications: children who are very young, disabled, or who has emotional immaturities, are unable to understand and cooperate. If a child is very young, he is not able to understand anything. The second is hypnosis. It's given by Franz A. Mesmer in 1973. So basically it's a state of mental relaxation and restricted awareness, in which subjects are usually engrossed in their inner experience. So basically this is induce the induction of a state of consciousness in which child or a person is apparently lost the power of voluntary action. So he is not able to move his hand or feet, so he can lose the power of voluntary action and is highly responsive to suggestion or direction. So he is not following his inner insecurities or inner things, but he can follow the suggestions or directions given by the dentist. Basically it's used in therapy. So typically it's used for recover the suppressed memories, or second is it's used for allowance of the modification of the behavior. But it is still controversial because it said the person who is trained, it he can only perform this hypnosis. So mainly the uses are it reduce the nervousness and apprehension. Second is eliminate the defense mechanism that patient used to postpone the dental work. If patient is not allowing the dentist to work, so it can uh, reduce the anxiety. Then control function and psychological gapping. And fourth is prevent thumb sucking and bruxism. And last one is to induce anesthesia. When patient is in relaxed state or patient is not stressed, so he can allow the dentist to give anesthesia. Next is distraction. So distraction, basically it is a tactile design to divert it's basically used to divert the patient's attention away from the current behavior to focus their interest on something else. So he can focus on something else. So basically use of poetry, drawings, fairy tale shows, instrumental music stories, video games, cartoon, audio type stories, etc. Audio analgesia or white noise, it was given by Gardner in 1959. So it's basically used to, it is a stimulus, which a stimulus distraction technique, which consists of providing a sounds of stimulus of such intensity that the patient finds it difficult to attend anything. So that if child is listening to something else or some nice music or which whatever he likes or she likes, so he is cooperative and he is very help, I mean he child will be very cooperative. So there is methods which are available for this. One is visual imagery. In this visual imagery means child is imagine something else. Basically we can call it daydreaming. We can give some situation to the child, or we can tell the child he can imagine about some nice place or nice thing, so he'll be distracted. Relaxation is mainly a hypnosis or related to this. Then visual or verbal self talk. So child can talk to herself or himself only. So basically it's a motivational talk. Sometimes we tell ourselves that I can do it, I'll do it. So basically this is related to this. And last one is virtual reality or virtual world. So virtual reality, we can say it as a two or three dimensional graphical representation or a live videos, or any auditory or touch sensation. So in which child can imagine a situation and he is sitting on the dental chair, but this 3D graphics or this sensations, he can feel that he is there in that situation. We have seen in malls or some games. So nowadays many 3D games are available in which we can feel that we are in that situation, or we are in that place, or if child can imagine he is driving a car or he is driving a bike or he is playing something. So basically these are the distraction techniques. Same visual imagery daydreaming which I have explained. um, so, the subject asked to imagine his favorite place or his favorite activity, and he can act as a fantasy during the dental treatment. Then use of poetry or drawings. Poetry technique is employed in children who is more than 7 years, and the poem is written in a collective effort, the dentist contributing on a line and child the next. So the example is teeth are white when they are bright, teeth do shine when you clean, teeth are happy and healthy, teeth stay long and strong. So basically in poetry we can use the words like shine, happy, long. So it's easy to make the child understand the importance of clean, healthy and strong teeth. Then drawings, it's useful for 3 to 5 years of age. So child is given a paper and pencil or mainly crayon and is asked to draw some picture. Advantage of this is it's allows repetition without monotony, gives the child a sense of achievement and increase self esteem. If child has draw something and dentist praise him, so it will help him to reinforce the positive behavior. We can say it positive reinforcement. So and it destroyed the uh, preconception that the about dentistry or dentist or clinic. So next time willingly child can come to the dentist and he'll be happy that he'll get some this drawings or these things. Then assimilation and coping. So if a child is stressed, he can't cooperative, or if child is stressed, the pain perception will increase. So this stress can act to increase the pain perception, while coping decrease it by process called assimilation. So this whole process is called the assimilation, and the coping, which is a technique, it decrease the stress. So coping decrease the stress, and this process is called the assimilation. Copy means to cope up with something. If child is showing negative behavior, so that you can modify the behavior of child or you can make his behavior positive. So basically this is a coping. And this is of two types: cognitive and behavioral efforts made by an individual to master, tolerate or reduce the stressful situation. So basically this is used for reduce the stressful situation. So these are two types: behavioral and cognitive. Behavioral is a physical and verbal activities which I have explained. Verbal activities, you can talk to the child or anything, and the verbal physical activities, you can give some toys or some things in a child's hands, or you can reduce the stressful situation, the drawings or anything else. So these all are behavioral. uh, Basically we can modify the behavior of child. And cognitive, it's not seen by dentist. So it's dentist can't see this, but the example of this cognitive type is imaginary or relaxation state. I have explained earlier that patient can imagine something else, or he can distract his mind. So these are imaginary and relaxation. So he get relaxed and he'll be more cooperative. Then aversive techniques. So aversive conditioning can be safe and effective method of managing extremely negative behavior. So basically these are used to manage the extremely negative behavior. Two common methods are there. First is home hand over mouth technique, and second is physical restraint. So first home is given by Dr. Evangeline Jordan in 1920. So indication mainly this is used for child who can understand, so but who exhibit a defiance and hysterical behavior during the treatment. Defiance and hysterical means the child is forcefully, or it throws the temper tantrums, and he is highly uncooperative. Child who can understand simple verbal commands, a child who can understand very easily, he has not any emotional issues, or not medically or physically handicapped, but they are not cooperative. Contraindication is the immature child, and second is when it prevents the child from breathing. If child has any breathing issues, this technique should not use on that child. So other terminologies are aversive conditioning, Lencher and Wright in 1975, emotional surprise therapy, Lemsphere, hand over mouth airway restricted, HOMAR, Levitas 1947, Aversion, Kramer 1973. So basically this technique is after the dentist can determine the child's behavior, and dentist can find out the child is not cooperative, then dentist firmly place his hand over the child's mouth, and behavioral expectations are calmly explained. Behavioral expectations are like dentist can explain into child's mouth that he has to behave like this, he has to do this, he has to listen this, and calmly he can explain this close to the child's ear. When the child's verbal outburst is completely stopped, or when child is in relaxed state, or child get relaxed, and when he indicates or when he says yes that he is willing to cooperate, then after that dentist removes his hand. So mainly it should be noted that the child's airway is not restricted while performing the technique. Airway is not restricted, and the whole procedure should not last more than 20 to 30 seconds. So basically on one go, dentist can place his hand over child's mouth for 30 seconds. After 30 seconds he has to take out his hand, and again if child is negative, then again he can place his hand over the child's mouth, but till the 30 seconds. The several variation of home, there are different variations. A hand over mouth with the airway unrestricted. So only hand is placed over the mouth, not over the nose. Second is hand over both mouth and nose, and airway restricted. So nose, dentist can place his mouth over the nose also. Then towel held over the mouth only, dry towel held over the nose and mouth, and wet towel held over the nose and mouth. So there is some legality of use of home issues. So recently there has been a lot of controversies and criticism regarding the home as a behavior modality, because some guardians or some parents will not allow to perform this techniques, and it is believed to cause, sometimes it caused a mental scarring and a psychological trauma to the child. If child can't breathe, or sometimes he get scared due to this behavior. Then HOMAR, hand over mouth, airway restricted. The advantage being airway restriction is that the child will be quiet so as to breathe, and the screaming will decrease so that the doctor can proceed. Because if a child cannot breathe, so eventually he'll stop crying, or he will stop shouting, because he has to breathe. but this technique could be performed only for 15 seconds, not more than 15 seconds. The second are physical restraints. So restraints are usually needed for children who are hypermotive. So children who can use like moves his hands or legs a lot. So restraints are for those children on who are stubborn and defiant. So physical restraint involve restriction of movement of child's head, hand, feet or body. uh, it's used for head, hand, feet and body, and it's a two type, active and passive. Active means restraints performed by dentist, staff or parent without the aid of restraining device. We don't use any device for this. It can perform by the dentist or parent, or we can tell the dental staff. If child is not cooperative, then we can tell the dental staff to hold the head, or parents to hold the hand or legs. And the second is passive, it with the aid of restraining device. There are variable devices are available in market, so we can use this device also. There are four types of restraints: for body, for extremities, for hand and for mouth. So for body we have five types: paddy wraps, pappus board, sheets, beanbag with straps, towel and tapes. For extremities, velcro straps, posy straps, towel and tapes. And for the head positioner, forearm body support. I'll explain in later slides. And mouth, a mouth block, banded tongue blade, mouth prop. It is used at the time of local anesthesia. So mouth prop is basically used for physical or mental handicapped child or young child who cannot keep his mouth for a longer time, and child becoming fatigued because of long appointments and frequently who frequently closes his mouth. In that case we can use this mouth props. So first is restraints of the body. First is Pappu's board. It is simple to store and use, available for both large and small children. It's available in both the size, and attached head stabilizers also. So it necessary to monitor the respiration if it is used in combination with sedation. And an extremely resistant patient may develop hypothermia if immobilized too long. If we can place these restraints for too long, so it can cause hypothermia. Hypothermia means increase temperature. Then second is sorry, you can see here there is a sheet, and the dentist can wrap around the child's body. So basically these are for the body. Second is triangular sheets. Triangular sheets described by Mink, the bed sheet or triangular sheets technique in controlling the extremely resistant child. It allows the patient to sit up, right? You can see in the uh, first image, the child is sitting in the chair and the sheet is wrapped around his body and the chair. So it allows the patient to sit upright during the radiological examination. Same hyperthermia and airway impingement may be problem during the long period of immobilization. In second and third picture, you can also see the sheets which are the wrap around the child's body. Then paddy wrap. Paddy wrap, it is available with or without the backboard. It also comes in various size, and it's available in market. You can, maybe it's available on Amazon also. So it's also come in various size and allow some movement while still confining the patient. So basically it's a board, with board or without board, and it's doesn't completely cover the child. It has the four or five steps which can cover the child's body. So it's a mesh fabric permit for the better ventilation. It too requires steps to maintain the body position in the dental chair and constant supervision to prevent the patient from rolling out of the chair. So basically it's a five or six steps which can help to hold the child. Beanbag with steps. Beanbag means there is a thick, you can call it as a thick sheet, or which can support the child to sit or sleep. So basically it developed to help comfortably accommodate hypotonic and severely spastic person who need more support, the patient or the children who need more support rather than immobilization. So patient who need more support, for them we can use this beanbag. You have seen the bean bags. So these are the reusable and washable, and one size fit the most patient, and many patient with physical disabilities relax more in this setting. So basically it's a use for physical disabled or patient who has the severely spastic issues and who needs more support. Then extra assistant or safety belt. Extra assistant can help to hold the child, and safety belts, this child's arm and leg can be immobilized with the help from the parent or dental assistant, and some belts are also available which can help to hold the child on the chair. Then second, restraints for the extremities. So restraints used for hands and legs. So first is a posse step. Posse step fasten to the arms of the dental chair and allow limited movement of the patient's forearm and hand. So basically it can wrap the patient leg or hand, and these steps can also attach to the dental chair. So child cannot move his hands or legs. It prevents the action by restraint. Then towel can also used in this. Wrapping a towel wrapped around patient's forearm and fastening it with adhesive tape is often helpful for ethetoid spastic cerebral palsy patient who tries desperately but without success to control body movement. So this towel can, if you don't have any device, then you can wrap the towel around the child's sorry patient's forearm, and you can wrap the adhesive tape over it so that child cannot move his hand. Then restraints for the head, head positioner and forearm body support. Head positioners are also available in market. The head positioners are similar to the which one which people use in the journey, or which can use for the neck support or head support. The these are similar to that. And second is forearm body support. So a patient's head position can usually be successfully maintained through the use of forearm body pressure. So dentist, the other hand of the dentist, he can wrap around the child's head so that he cannot move his head. And the last one is restraints for the mouth. So in this, these are the common mechanical aids for maintaining the mouth in a open position. So mainly these are the padded or wrapped tongue blades, mouth prop or rubber bite blocks. In this picture you can see the tongue blade which can use to control the movement of tongue. So tongue blade, it is easy to use. This is the transparent tongue blade in this photograph. So it is easy to use, disposable, and it's very inexpensive. These are the various type of mouth props in this picture. First, mouth prop is regularly used in dental clinics. Second is new block disposable U-shaped mouth prop. Third is ebony handle mouth gag. Then finger thimble. So dentist can wrap this around the finger and he can place into the children's mouth. Then Ainsworth double grip, a malt mouth gag, C prop mouth props, NOLA dry fill system. These are the complicated system which can uh, use for open the child's mouth. Then mouth, the second last is mouth prop with tongue guard. So tongue guard is attached to the mouth prop, so it can help in open the mouth, or also it can control the movement of tongue. And last one is mouth prop with saliva ejector suction tip. So suction tip is attached with the mouth prop, so it can do the suction and it can help in open the mouth. So basically this mouth prop is used in the two quadrants but in the similar arch. So suppose if I am working on 4 6, so I am placing the mouth probe on the opposite side. So between the left arch between the first and third quadrants, and is this mouth prop is placed on the occlusal surface of the upper and lower teeth. So this are mouth props are very easy to place, and it disposable and available in two sizes, but this mouth prop is slightly more expensive. Mouth props are expensive, but that mouth this bite blocks are a bit cheaper. So it can be purchased in various sizes to fit on the occlusal surface of the teeth and stabilize the mouth in the open position. So these are the rubber bite blocks. uh, Thank you.